Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
So first, arteriolar dilators. Arteriolar dilators are mainly three drugs. In the arteriolar dilators, we have diazoxide, minoxidil, and hydralazine is the arteriolar dilators. These are actually pure arteriolar dilators. All these three drugs will release potassium channels. So they are potassium channel openers. We'll open the potassium channels. So they are potassium channel openers, all the three. All are potassium channel openers except that this hydralazine is a potassium channel opener, and it is also the nitric oxide donor. It will also donate nitric oxide also, thus causing activation of cyclic GMP leading to dephosphorylation of the myosin light chain kinase leading to relaxation. Then this minoxidil also has an antioxidant property also. So hydralazine has three actions. One, it acts through potassium channel openers, nitric oxide donor, and antioxidant property. Pharmacokinetics. In the pharmacokinetics, first these drugs are short acting drugs. They have rapid first pass metabolism is present, and they are short acting drugs. Because they are short acting drugs, they have a half life of around 1 hour is present in them. And then the minoxidil, the drug minoxidil is mainly eliminated by the bile, and this minoxidil is safer in renal failure. Then we have hydralazine. The hydralazine is mainly metabolized by acetylation. Hydralazine will undergo acetylation and thus it is metabolized. Then uses of arteriolar dilators are the arteriolar dilators are used as drug of choice for hypertensive emergency in pregnancy. Then we can also use them in hypertensive emergencies. Or minoxidil, the drug minoxidil is used in male pattern baldness. Minoxidil has while giving minoxidil to the patient, it has been found out that minoxidil has a side effect of hypertrichosis. That is, increased production of hair is seen with minoxidil has a side effect. So we started using minoxidil for male pattern baldness. Then diazoxide drug is actually while seeing for hyper while doing hyper while seeing for high side effects, we have found out that this diazoxide produces hyperglycemia. So the side effect profile of diazoxide producing hyperglycemia has been modified as the treatment. So the diazoxide is used for the treatment of insulinoma, because in insulinoma there is excessive insulin secretion, and as a result there will be breakdown of glucose and several hypoglycemic episodes are seen in insulinoma. So if you give diazoxide has a side effect, it causes hyperglycemia. So this side effect can be used, this hyperglycemia is used as therapeutic effect in patients with insulinoma. Then, but this diazoxide is not the drug of choice for insulinoma. So the drug of choice for insulinoma is actually streptozocin is the drug of choice for insulinoma. Then we said that the drug of choice for hypertensive emergency in pregnancy. See, drug of choice, there is a controversy in this. The drug of choice for hypertensive emergency in pregnancy, this according to the Harrison, the drug of choice is labetalol. But according to JNC 8 criteria, the drug of choice for hypertensive emergency in um, pregnant women is hydralazine, which is an arteriolar dilator. Then, side effects of arteriolar dilators. The side effects of arteriolar dilators, obviously, because they decrease the blood pressure, they can cause hypotension, has the most common side effect. Because of decrease in blood pressure, there is activation of sympathetic system resulting in reflex tachycardia. Because of its side effects of reflex tachycardia, it is contraindicated in ischemic heart disease. The drug diazoxide mainly results in hyperglycemia because this will inhibit the insulin release and thus it causes hyperglycemia. Whereas minoxidil is found out to have increased hair growth, that is hypertrichosis is seen where there is increased growth of hair. Then these arteriolar dilators can have a side effect of fluid retention. And hydralazine mainly it causes discoid lupus erythematosus or systemic lupus erythematosus has main side effect. These will also increase the renin.
Thank you and thank you for watching.